Kidney disease, sometimes there are no signs or symptoms till very end. But in some patient, they might have swelling over feet or body and reduce in appetite, nausea. Uh, these are the some of the early signs. So, but one should not wait for the signs to develop. If somebody has high risk of kidney disease, that is people with diabetes, people with hypertension, people with family history of kidney disease, or who are smoke, who obese, these those in the high risk group, they should do their routine checkup for to detect kidney disease in the early stages. People who are at high risk of developing kidney disease, like those with diabetes, those with hypertension, those with family history of kidney disease, uh, and elderly, they should do their checkups in form of urine albumin uh, and serum creatinine to know what is their kidney function and whether they need to go to a specialist if there is any problem in their tests. We need to understand this that the diabetes and hypertension, they are the two leading cause of kidney disease, and diabetes is common in India. About 10% people have diabetes, 25 to 30% people have hypertension. So 40% of the patient with kidney disease, they have diabetes. And diabetes and hypertension, obviously, they are related to lifestyle. But these usually causes kidney disease in later in the life. But there are other causes of kidney disease, like if you have some glomerulonephritis, that is the protein in the urine because of the uh, immune mediated diseases. There is a damage to the filter of the kidneys, and that can happen in very early in life. So we see a lot of patients in early stages and 20s, 30s, and there are some genetic diseases in which the even the children, they have kidney diseases, and by the age of 10 or 15 years, some of them will need dialysis or kidney transplant. So kidney disease can affect all ages depending on the cause. Genetic disease, glomerular disease, sometimes because of the drugs and some toxins, and you can develop a kidney failure early in the life or later in the life because of the stones sometimes which are not treated on time, or sometimes some obstruction like prostate problems or some malignancy or something, you can develop kidney disease. So there's a whole variety of kidney diseases, and but it can affect you at any age. Lifestyle diseases like diabetes and hypertension are very important, and they are increasing. Kidney disease is now become the seventh leading cause of death worldwide. Previously, it was 12th and 13th, and it is projected to become fifth leading cause in next decade or so. The kidney stones are common, and some time back I wrote an article about kidney stones, and I know that approximately 5 to 10% people might develop kidney stone over their lifetime. Depends on the place where you live, your eating habits, and everything. Kidney stone could be because of the some genetic condition in which there is a recurrent kidney stone formation tendency, and because of the again this metabolic risk factor like diabetes, obesity, drinking less water. This all plays a role, and the important thing is to remember that if there's a kidney stone, which is a big kidney stone, more than 8 or 9 mm, it is unlikely to pass through your system. So the kidney tube, which is ureter, is usually 6, 7 mm. So if your stone is more than that, it's very unlikely that it will pass. And if it remain impacted over a period of time, long period, it can damage your kidney. And that is the reason for many kidney problems overall. Sometimes people go for alternative therapy and they waste their time and the years that will be removed by those drugs. That's not really helpful. Small stones usually pass by themselves, but big stone don't wait for this. If there is a stone which is there and it's not being passed, you should get it removed to protect your kidney. So one of the reason could be you could say, fault of the medical system, that we as allopathic doctors are not able to generate enough trust in the people's mind that allopathy is based on the scientific uh, basis, and the therapies are done, and there is some research behind that. People want to go easy way. One of the things, there are two things in India. One is their traditional thinking. There is a inherent trust or thinking in mind that if something is natural or Ayurvedic, homeopathic, that causes less side effect, and it is probably effective. But it's not so actually. These are the people want to actually avoid the pain, or you can say there is a misconception that uh, sometimes these therapies are not necessary, and you really have to unnecessary things the doctors are doing, and then if you go to the alternative medicine, you will get relief. There are a lot of advertisement is going on nowadays, you see everywhere, and people don't just actually do any research or read or this thing, and they just go on the advertisement. So this is what you see, the something 100 times, you keep on believing that, you start on believing that, and once they go there, unfortunately, after some time when they fall sick and they land into complication, then they come into hospital in serious condition, and they spend more money, and their health is also really does not improve so much. So I would say कि a scientific attitude is very important. Wherever you go for any treatment, for either allopathy or Ayurvedic or whatever, you should ask questions to the doctor. Is that why you are doing this treatment? What is the benefit? What is the risk? And why is it important? Why it is necessary? I'd say recently there is an incident in my family. One of my relatives, she had a chest pain, and she was in acute coronary this myocardial infarction coronary syndrome, and but then she was not actually willing to go for the cardiologist advice and angiography with lot of effort. We had to tell her "Ki this is really important," and then she underwent angiography and angioplasty, and then she got late, and later on she realized that. But sometimes people are not able to make the right decision, and they fall sick. I think people need to question more. They need to not just believe. See, a lot of these treatment, Ayurvedic and all that, was done when there was no modern facilities, no modern lab tests to diagnose. Allopathy is only developed in last 200 years or so, and there is a progressive changes in that based on the research, based on the evidences, and the therapy keeps on changing. So how can you apply something which is a 500 or 1000 or 2000-year old to the today's context when you don't know the diagnosis of the disease? So I would say be more science oriented, question more, and then that is what is lacking, and people are attracted towards the easy way, and but there is no easy way. There are various type of hospital. You need not to go to always to a corporate hospital. See, the corporate hospitals, they are based on the various because you have to generate your fund. There is staff, there are doctor, there is a maintenance, and there is everything. I myself, when I was a student, my brother, he had a valvular condition, and we used to go to AIMS for the treatment. I used to be there for 6 hours or 12 hours a day to see the OPD. So there is always the option. There are trust hospital, there are charitable hospital, there are government hospital, there are government clinics, or not everyone needs to go to the private. So this is one. Or second thing, you are telling about the cost. I tell you, you go to the any of these Ayurvedic institute and all that. I have patient. I tell you, you are talking of 500,000 rupees. I had a patient with type 1 diabetes who was lured that he will be treated with type 1 diabetes, require insulin. He went to some ashram of a Baba, and for 2 weeks he remained there. They stopped his insulin and they charge him 5,000 rupees per day. And then after 2 weeks, his sugars were going haywire. He fell sick. He had to come to the hospital. You are wrong. These people, the therapy in the Ayurvedic and all these is costlier. They give, I don't know what drugs, and they spend lakhs of the rupees. One of the patient came to me he was taking Ayurvedic treatment for kidney disease. What he was spending 20,000 per month, and for drugs which I wrote would cost it 3 to 4,000 per month. So you have to pay for the expertise and quality, and it is not necessary. And this is a big. You ask the people who are actually taking Ayurvedic treatment for these Ayurvedic institute and all that, because we all the time get patient with kidney disease. There are many these institute who are claiming, and the people are spending lakhs of rupees, compromising with their health. And you tell about the cost. Somebody asked me what is the cost of a private school fees in NCR. It's not less than 10 to 15,000 per month. If you go to better school, it will be so. Why there is always a question on the fee? What is the cost of the consultation of a lawyer in High Court or Supreme Court? My only request and advice to the people would be that you should not believe whatever is being said. One should question, one should ask the evidence, not just hearing, because the people do a lot of sweet talks. They will assure and do everything and just pull these patients for some time. And when they really develop any complication, if you develop, tell me, if you develop a chest pain or a breathing problem, where will you go? I am not against any alternative therapy. My only point is that there should be evidence-based therapies. Previously, in allopathy, also 100 years back, there was very few treatment to be offered. But over a period of time, with advances of science and research, there have been so many things which we can do. We can do kidney transplant, we can do bypass surgery, we can do a whole lot of things in every field. So you can't really, even whether it is the acute disease, there's a myth, acute chronic diseases and no chronic disease. Chronic diseases also you will treat with allopathy. It's about evidences. It's about we know our limitation. We tell people we can do this, we cannot do this. You should accept that. Maybe today we can't do this, tomorrow we can do this. So that's there. So that is my point. We should actually create health awareness, health literacy among people. And secondly, there should be scientific attitude, which is unfortunately is lacking, because whatever one person is seeing on social media, on TV, or on the print media, he sees that is truth. That is not truth. If somebody's kidneys are normal, eating more protein usually does not lead to any problem. If there's a kidney function is compromised and then you take a very high protein diet, then your kidney function uh, deterioration would be rapid as compared to the people who take low protein diet. So there are a lot of people who take high protein diet and it does not damage the kidney as such. But obviously, so if somebody has underlying condition which he is not aware of and then takes a very high protein diet, then the kidney disease might further increase. So otherwise, I am not a diet expert, so I can't advise on whether the keto diet is harmful. But this is the general evidence that taking good protein in the diet or even high protein would not. But one should check its kidney function, because you might not be aware that you have some mild degree of kidney problem or something like that. Two important causes, diabetes and hypertension. They are at risk of developing kidney disease. So you take care of your diabetes since beginning. When it start, don't wait for the complications to happen, because for many years, if your sugar or blood pressure are uncontrolled, you are likely to develop either kidney disease, heart disease, or other. So most of the chronic diseases, 70 to 80% causes either diabetes or hypertension, whether it's a kidney disease, it's a heart disease, or it is stroke or something like that. Then we coming to other diseases like stone. As I mentioned, if you have a stone which is a bigger, which cannot pass itself, you should get it removed. You should go to a qualified person, a urologist for that stone. And you should not take too much of the non-steroidal. There are some type of the painkillers which can sometime damage your kidney. You should avoid taking medicines which have high metal. Some of the alternatives, especially Ayurvedic medicine, they have heavy metals in that, and that is known to cause kidney damage. The one should avoid using that. This bhasm sort of thing, they can really damage kidneys, and we have seen many cases of kidney diseases because of that. Uh, if you have a family history of kidney disease, then one should do your checkup to know whether you are vulnerable to that sort of disease. And then there are genetic diseases again. So if you have predilection, then one should go and do his routine checkup.